Hello, my name is Hani Chanbour. I'm a postdoc research fellow at Vanderbilt's Spine Outcomes Lab, which is a joint collaboration of the Neurosurgery and Orthopedic Department. Thank you for the CNS for the opportunity to share our work, all of which was performed under the mentorship of Dr. Scott Zuckerman. This is a multi-center study of the impact of unplanned readmission on patient-reported outcomes after cervical spine surgery. The occurrence of an unplanned readmission has been recognized as a surrogate of outcome and quality of care in several neurosurgical procedures, and little is known regarding its impact on cervical spine surgery outcomes. Therefore, using the cervical module of the Quality Outcome Database, we sought to first determine the impact of unplanned readmission on patient-reported outcomes, and second, compare the effect of specific readmission reasons on patient-reported outcomes. This was a multi-center, retrospective study including adults undergoing elective cervical spine surgery for degenerative pathology with at least 12 months follow-up. Any patients undergoing surgery for infection, tumor, trauma, or any non-degenerative reasons were excluded. Outcomes were 1-year NDI, NRS, EQ5D, and dissatisfaction. A total of 13,000 patients underwent elective cervical spine surgery, and the overall 90-day readmission rate was 3.8%, which is lower than what has been previously reported in literature. The most common readmission reason was surgical, followed by medical and pain-related, and all patients had a significant improvement in patient-reported outcomes from pre-operative period to 3 months and 12 months post-operatively. Our key findings were that patients taking opioids had significantly more pain readmissions compared to patients without preoperative opioids, and while surgical and pain readmissions were consistent predictive of worse outcomes at 12 months, no significant association was found between medical readmissions and patient-reported outcomes. And for specific readmission reasons, surgical site infection or any wound-related complications and reoperations were consistent predictors of worse patient-reported outcomes, whereas DVT, PE, hematoma, seroma, dysphagia, neurological deficits, and GI-related readmissions and other medical readmissions were not associated with patient-reported outcomes. Similar findings were demonstrated when dichotomizing the data according to anterior versus posterior surgery. The evolution of patient-reported outcomes from pre-op to post-op in patients undergoing readmission are presented in the figure on the top right, and the heat map represents the significance level for each readmission reason for each outcome from the multivariable regression. On the left-hand side, we can see the readmission reasons, and on top, we can see the patient-reported outcomes, and the dark color indicates stronger correlation. So in conclusion, unplanned readmission can be considered an indicator of worse patient-reported outcomes following cervical spine surgery. And finally, I want to thank everyone working at the Neurosurgery and Orthopedic Spine Outcomes Lab for their phenomenal effort, specifically Dr. Stevens, Dr. Abtahi, and Dr. Zuckerman. To find out more about our study, please click on this link below to access the full article.